Good evening, ladies and gentlemen. Welcome once again to another episode of Horizon Blossom with Dr. Arusha. We're so happy to have you join us. Today, we're going to be speaking about a very important topic, raising a child with autism. Now, we know that according to the website, cdc.gov, autism is described as part of a group of conditions called autism spectrum disorder. And this is a developmental disorder that can cause significant social, communication, and behavioral challenges. There is often nothing about how persons with ASD look that sets them apart from other persons, but persons with ASD may communicate, interact, behave, and learn in ways that are different from most persons. We'll hear from two families and some therapists who will share what it's like to raise a child with autism and also give advice to others who are in that situation as well. I'm looking forward to introducing them to you, but before I do so, you'll join me in a word of prayer. Heavenly Father, we give you thanks, we give you honor, we give you glory. Lord, this is the day that you have made and we will rejoice and be glad in it. Lord, we want to lift up all families with children with autistic spectrum disorder. We pray that you would continue to give them the guidance, Lord, the strength, Lord, and the strategies, Lord God, to navigate in these challenging times that we are all facing. Lord, we want to thank you for our guests today. We pray a very, very special blessing on the families represented here. We pray a blessing on the therapists. Lord, we want to thank you for our audience and that you'd continue to bless them and guide them and provide for them. We give you all honor and all praise. We put this evening's proceedings into your hands and we glorify your name in the most precious name of Jesus. Amen. So ladies and gentlemen, remember we'll have the interview segment first and then we'll give you the opportunity to send in your questions and your comments, okay, to the therapist. So welcome, guys. I'll give you an opportunity to introduce yourselves. You can tell us a bit about where you're from and what you do. I'll start with Baja and Ricardo. Powell.
So I'm Basha Powell. I'm a media personality and CEO of Basha TV Productions, LLC, which started in Trinidad and Tobago, and now we operate out of Alpharetta, Georgia, just outside of Atlanta.
Hi, I'm Ricardo Powell. Originally from Jamaica, now Jamaican Trinidadian, living in the United States of America.
Awesome, welcome guys. Mrs. Francine Noel.
Hi, afternoon everybody. I'm Francine Noel and I'm a former attorney at law, now autism blogger. I'm a mother of two and a 14-year-old son, 11-year-old daughter, and my son has autism and happy to be here.
Thanks so much for joining us. We love that tropical background.
That's right, I'm in Jamaica and I'm Jamaican.
Okay, and we have Miss Shanika McIntosh.
Hello, everyone. My name is Shanika McIntosh. I am from the Bahamas. I am an occupational therapist as well as a certified autism specialist.
Excellent. And we have Dr. Pauline Watson-Campbell.
Good afternoon, everyone. I am, as you heard, Pauline Watson-Campbell. I'm the founding director of the Macam Child Development Center that caters to children with a variety of issues, as well as children who are typically developing. I'm a pediatric occupational therapist and also an educational psychologist.
Excellent. Welcome again. And last but certainly not least, we have Miss Georgia Rose.
Good afternoon, everyone. I'm a clinical psychologist. I practice in Western Jamaica. I have been in practice for over 15 years. And one of my loves and passions is for working with children with developmental disabilities.
Excellent. Welcome, 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 ladies and gentlemen. Okay, so we'll start with Basha and Ricardo Powell. Welcome again. Ricardo, I think I cut you. Did you get to tell us what you do?
No, he didn't.
No, I didn't really go into that. I mean, I'm a former West Indies cricketer and now
Yay!
I run my own cricket academy out of the US. And yeah, I think that's a bit of what I do.
Yes, Ricardo is so very modest, but we're so proud of you guys. All right, so how are you guys doing?
We're doing very well, considering everything that, when you look at what other people are going through, then, you just say, thank God you're alive. And so I would just stop there. We're doing very well.
I think most important thing at this stage is that you have health and strength. And at the end of the day, you see what's happening on the news every day. People are dying. People can't see their family actually in hospitals and stuff like that. So we're in positions now where we constantly have to give thanks every day.
Yeah. Amen to that. And just tell us a bit more about your family.
So I think it's public knowledge in most parts of the Caribbean, and I guess in parts of the cricket world where my husband would exist, that we have a son. Well, we have two sons, but one with autism. His name is Ross. He's now 12 and a half years old, and he's doing very well. And this journey first started after he was diagnosed at 2 years old. We were living in Trinidad and Tobago at this time. And it really, back then, it felt like this just turned our whole world upside down. So parents with a kid with autism.
Totally. And then can you share more about what it was like along the journey, raising a child with autism? What has your journey been like? Whatever you're comfortable sharing.
I would say, as I said earlier, my wife mentioned that we started in Trinidad and Tobago knowing and basically finding out that he was diagnosed with autism. We tried.
Well, he was diagnosed in Miami at age 2.
Yeah, we tried briefly in Trinidad to see how best we could assist him there and also other kids diagnosed with autism. We tried for a year where we started a school where we hired a professional from England and also implemented quite a few things to try and assist kids there. But after a year, we realized that it was too much. We couldn't really carry this burden. And we decided to make that move to really basically look out for our son, because at the end of the day, no one else was going to look out for him. And all credit to my wife, because she was the whole driving everything behind this in terms of making sure that our son was able to get the best treatment, to get the best education, and also to make sure that the family was in the best position to be there for our son.
Anything you want to add?
If I could say something, Arusha, I think my husband is crediting me with a little too much at that stage. I'll take all the credit now, right? But back then, I was in a really bad place. When I look back, I don't even like who I became, because I allowed myself to be sucked up by this diagnosis. And strangely enough, for those of you who don't know and who are not acquainted with my journey and my platform on Basha TV, I was that when he was diagnosed with autism, it was a year after I just completed chemo for breast cancer. So the only thing I didn't say was, why God, why? Because I was trained not to say that. That's not a nice thing to say. But I had moments when I felt it. So I went into the autism journey as a victim. I didn't know that at the time, but I did not have the best attitude towards our son's diagnosis. And emotionally, my husband carried me. So while I was being tactical and businesslike about, we just got to go to America, we just got to have to fix this, in my mind, I thought I was going to treat it like chemotherapy allowed me to be healed. And so for the first 2 to 3 years of his journey, his diagnosis, getting to know about autism, I'm just keeping it real. I don't like how I handled it emotionally. I was not emotionally mature enough to deal with it.
Boy, Basha, I remember bits and pieces of that journey too, and I think you shouldn't be so hard on yourself. I understand what you're saying, but when life throws you the unknown, who says what's the right way to handle it? You know what I mean? We just have to try our best.
I was resentful. I was not of him, but I was just, my life turned upside down. I had to give up my entire career to move to America, to now deal with him. Fast forward, best thing that God ever did for me.
There you go. There you go. Trust me, you are one of my heroes, because to be, to have to deal with breast cancer and then that diagnosis and pivot. Trust me, you are one of my heroes. And I know you rely strongly on God's help. And look what the Lord has done, eh? So basically, how now has COVID impacted you guys? Because I know everybody has been impacted one way or the other by COVID-19, this pandemic. How has it affected you as a family? Anything you're comfortable sharing?
I mean, one of the good things, I would like to start with the positive first. I mean, the most important thing about COVID for me is that it allows me now to be home more, to spend more time with my family, to even understand the day-to-day routine of my family, to be able to be here for my wife more, to be able to be here for the boys more. I mean, yes, it's restricted us from going places and to socialize and stuff like that. But I think our family has grown closer during this time. There are a lot of things that we took for granted during the normal days, and now we literally sort those things up, and we look forward to days when we meet as a family and have our family chats and stuff like that. I think in this life, we are going to go through things that are going to throw us off our radar and put things in a different scheme altogether. But at the end of the day, it's about your outlook. You're going to have the days, just like in normal times, good days and bad days.
Yeah.
And you have to just ride through those days and know that, and see that whole vision ahead of you in terms of what you're trying to achieve, and know that God have you here for a reason. He's going to take care of you. And the days when you're not strong, you have somebody there to pull you up. And when you are up, try to pull somebody else up.
For me, I would say, so just to back up a bit, prior to, as it relates to Rossi and raising him, because both of our kids have been affected differently. So we have a teenager who's soon to be an adult. This is an inconvenience. He wants to play basketball. He wants to do whatever. It's all about him, right? And even in even saying that, he still has handled it like a champion. I'm still proud of, I don't know how I would have handled it at 17, 16. You know what I mean? With regards to Russ, strangely enough, prior to COVID being the biggest challenge of all our lives, we had taken a decision to homeschool Russ. I found that Russ became, and I want to say this for parents who are listening, because this was something I stumbled upon. Between the ages of 2 to now, Russ gained tremendously from in school learning, and he was doing very well. The therapy and so on that he received, it was excellent. He was blessed to have really good teachers and therapists and so on. But what I discovered, maybe at the beginning of the year, late last year, was that he had some other development gaps. And I'm talking specifically to parents with these kids with autism, that I figured that only myself or my husband could fix. I don't know if I'm resonating with anyone, specifically with regards to even his reading. Rossi couldn't read, but he was a nonverbal autistic child for a long time, and his words started coming. But somewhere between realizing that, hey, if he spent more time with me learning a different way, maybe that's what's ideal for him. So prior to autism, prior to the pandemic, we registered him for an online school, great school and everything, but it means that he would get to learn differently. Like his type of learning, he loves to travel and have experiences. And when we're traveling or we're in London or something, we'll talk him through this. If we're doing a transaction at a store, we'll say, okay, mommy has $100. How much is she gonna get back now? This is learning for him, things that we take for granted. And maybe it was God guiding, and it usually is. And I took the decision, hey, this child is coming out for a while. Let's find him where I can be at his side so I can assess his greater need. I realized that we got to a point where the parents had to become the coach, the guide, and more intimately involved in learning and not leave it up to the teachers. And basically this time period has really, really helped with that, to the point that Ross and I published our book, Art is My Voice, during,
I got my copy.
during a pandemic. Now, he can't write. Let's not fool anybody. And I shouldn't say he can't. He didn't write this. He will in Jesus' name. But his art is what his mom and him together collaborated. And we were able to tell a story about a boy who left the Caribbean, moved to America because he had autism and his parents did not know what to do. Won't he do it? God is good.
Amen. Listen, when I saw that, I was like the proud auntie that had to go on Amazon and get my copy, guys. So guys, I am putting a shameless plug for us. Go on Amazon and get your copy. The art is beautiful, and you know, it's so amazing. And you know, I would read a little bit that really kind of touched me. And when he said one night his mom was praying and she asked God, "Is there a chance, Lord, you can give Rossi more words?" God responded by saying, "Art is his voice. Don't be absurd." I love that. Congratulations, Basha. As I said, you're one of my heroes, girl. You and Ricardo.
It hasn't been easy. I mean, I don't really want to be seen as a hero. I just want parents to know that this is possible. Whether you are a single parent, whether you are a parent, you're co-parenting, let me tell you, either way it's hard. Don't fool yourself. What I know is somewhere along the line, during my resentment phase, I said to my big son, my husband was traveling as he is often doing because he's a professional athlete. So I said to my son one weekend, I said, you know what? I was at my wit's end. I said, you know what? I am just going to raise Rossi the way I raise you. I don't know all these fancy things. And I'm talking to all my therapists on the panel. I said, I don't know all this fun. I'm just going to love my child and I'm just going to talk to him even though he's not answering me. And that's the day my life changed. On this autism journey. I just decided I'm just going to love him. I don't know any fancy therapy. All I know is love. And everything changed after that.
Wow. Wow. Powerful testimony, powerful testimony. So you mentioned that you guys had a lot of support in terms of therapists and so on. Did you have a lot of psychological support? Was that necessary? Tell us more about your support system.
So I'm not a professional. I know the professionals will address different types of autism, perhaps in the session later on. I mean, Rusty is very high functioning on the spectrum. So psychologically, he didn't need that type of support.
I mean, for you two as a family.
Oh, for us? No, we got each other in love and Jesus. Like maybe it was wrong not to go for counseling or something. But one time we did try to go for counseling in Miami, Arusha. And by the time we got to the therapist, I don't know if I was a little late. We didn't know that we had to fill out some paperwork before. We didn't know anything like that. And by the time we were finished filling out the paperwork, the therapist said, okay, well, you know, your session is up because you only had half an hour. My husband and I stood up in the car park after that and we watched each other and we said, what the hell? We're like, you know what? We're going to learn to talk to each other, work this thing, and we never went back because the lady tried to fill out the paper. You remember that?
Yeah.
Oh no, oh no, oh dear.
And I'm saying, P.S., note to self, all therapists are not like that. It was just our experience. But at the end of the day, our therapy was our relationship with God. It may not work for everybody, and I don't want to be idealistic, but it defined for me the difference between being religious and being spiritual, this whole journey. And that was our therapy. Serious. We had self-love already. We had each other. No matter what we went through, we knew that we had each other. Yeah, did we always communicate perfectly? No. He has more patience than me because I'm the loose cannon. So I would lose it many times, you know, but the love of God, his patience, my strategy, somehow it worked out and it made a recipe.
Thank God. Thank God. Wow. So any other advice you'd like to give to parents, to family members of of persons with autism, Any advice you'd like to give them? Any further advice?
I think Ricardo can speak to the dads. And I hate to be so sexist, but I don't know the experience through the eyes of a man. You know, I just know it as a mommy. I felt helpless. That's okay. I felt, oh boy, I'm going to fail at this. And that's not a feeling that I was comfortable with. I mean, we Caribbean women, we're brought up to be excellent. We're the business. We have to go to university, and we need to be able to be successful and bright. And bright, successful could not help me with a child on the spectrum who was not responding to my brilliance or whatever it is I thought I had. And I had to bring vulnerability and truth to the table. I had to bring unconditional love. I had to try and not change him and change me to help him. And I had to face all the things that I was fearful of about my own career. I had to give up a lot. Where the resentment came from, I had to give up a lot. Everything that I built. But let me tell you something about Jesus. Let me tell you, he will never take anything from you without giving you better.
Amen.
And that's my lesson there. And if you're working through this thing with resentment, get out of your own way. Put your child first after God. And put that child on the throne and just ask the Lord to guide you and listen. Because this took every part of, it's removed everything that was not supposed to be in the space. Ego, everything. Clean slate. Clean slate. And I just showered him with love. And today that boy, he's my heartbeat. When I'm so proud of him and how well he tries, just because I changed my approach. Because his father was always patient with him from day one. I didn't have that level of patience. I wasn't brought up like that. But when love took over and the ego left, and I just saw the gem that I had in my hand to mold and to allow me to grow and learn and make me a better person, that's when everything started to unfold for me.
Wow.
I think for me, growing up, I was always a patient person, and Rusty taught me even more patience. There were a part of me where I realized that, hey, your son has autism, what are you going to do? What do you really know what to do? And at that point, what I knew what to do was to, one, give unconditional love, two, to be patient and understand him for what he is, and to go through not necessarily emotion, but go through and understand day by day what he does, why exactly he's doing this. And the crazy things that you experience, later on you're able to laugh at it. But when they're nonverbal, it makes it even more difficult because you don't understand pain, you don't understand when they're hurting. Yeah. So it makes it even more difficult. So when you're showing unconditional love, and whilst they're not communicating and they see you there, loving them, giving them the attention that they need, it opens up things in them that you can't really explain. And I think eventually they develop a trust, and they start communicating with you in a way where you eventually understand.
Wow. And he started with arts.
Yeah, and for me, that is something that, leaving the Caribbean and coming here with him, I didn't care about cricket, I didn't care about West Indies, I didn't care about any of that. All I care about was making sure that I was here for my family unconditionally, because at that time we were both going through breast cancer and now into autism. So it's like God had you at a place where he said, hey, I have you here now, what are you going to do? What is the most important thing to you? And long and short of it, where we are now, that blessing has come around tenfold, because you trust him and he know that at the end of the day, you put him first, and knowing that he was going to take care of you, he was going to put you in the right place at the right time.
I just want to add one more thing.
Go ahead.
For somebody who's listening without hope, based on what my husband just said there, I have to say this because everybody will be like, oh, it is God thing. You know, people probably say, well, yeah, God. They could say that because they have money. Let me tell you something. When we left Trinidad and the Caribbean, we weren't sure how this whole thing was going to unfold to take care of this child with autism. Like we thought we had this plan to carry on our own business from here, and that didn't work. Everything was taken away from us in the pursuit of fixing, because that's what I thought I was doing, our son. And when I tell people that God never takes anything from you without giving you greater, he gave my husband a whole brand new career and business. You know, it had to be him, because it's not like we left and he said that he was going to do this. All these things that he's doing now, he said, hey, I'm going to do this because I got this figure. The only thing we had figured out was love and faith. Wow. So if you out there and you're trying to figure out what to do and God is leading your heart and telling you, hey, you just take that first step. He will figure it out. Because if he did it for us, if we could be living the life and saying, hey, and Rossi is now publishing and talking, and he was going for his glasses yesterday and he said, he's telling us in the car, Mommy, I'm excited. My child used the word excited, like to express his feelings and emotions about getting glasses. Wow. You have no idea that 8 years ago, 7 years ago, 5 years ago,
you pray for a word.
We were praying for a word. Wow.
Yeah.
So don't give up.
Wow. Thank you so much, guys, for sharing. There's so much that you shared. There's so much there in your testimony. You know, he turns our trials into testimonies. And I can only think of Romans 8:28, where it says, all things work together for good, for those that love the Lord and are called according to his purpose. And, you guys are such a great example. Thank you for being real with your journey. I know it wasn't always easy, but with God, all things are possible. I know you guys have to leave, but before you leave, I'll let you in on some of the comments so far, and then you guys can leave to your next engagement. So we welcome Janice, Auntie Janice, and Diane Fletcher, your mom, Francine, watching. Auntie Janice in the USA says, good evening, Dr. Arusha and panelists. I'm watching and anticipating. I have a grandson with autism. Wow, love to your entire family, Auntie Janice. And Pastor Diane says, my daughter, Francine Noel, she's giving you a shout out. And we have Davidia Trim says, scholarly panel. That is my favorite cricketer, Ricardo. Davidia Trim says that. Sister Elsie Frederick says, good evening, Dr. Arusha. God bless the panelists. Norma Chambers says, hi. Hyacinth Blake says, hi, Miss Rose. Tashiana Collins says, hi, good day, just logging on. My daughter, 2 years old and 10 months old, have epilepsy and autism. And we know that some children with autism spectrum disorder also have some of these other medical conditions. Sister Elsie says, whoa, congratulations, a great book. Congrats to you and Rossi. Delia Maxman, my cousin says, hi, welcome Delia in St. Vincent. Beatrice Williams says, good evening, doctor. She's in the US. Valia Felicia says, good evening, everyone. Love to hear this couple and their story. I am a board certified behavior analyst currently offering ABA therapy near Ocho Rios. Interested in learning more here today. Welcome, Felicia. Nikita Mullings says, please come. Okay, so they're communicating there in the chat. And we have Nikita as well saying that her son is autistic and she's hoping to learn something. Welcome, guys. And thanks again, Basha and Ricardo. Thanks for bringing the Christmas vibe and all your and your words of wisdom. Love you, love to the boys.
Love you guys, and thanks for having us. I'm sorry we have to go, but
understand
crazy.
fully.
Yeah, thanks, and good luck to all the mommies and daddies.
Thank you so much. So we move over to Francine. Welcome. How are you doing today, Francine?
I'm great. Thank you. Thank you, Dr. Arusha, for having me.
Thanks for being here. And tell us a bit about your family.
Well, as I had mentioned earlier, I I have a son, a 14-year-old son. He just turned 14 November 1st, Zachary, and
belated.
and an 11-year-old daughter, Eden, and my husband, David, who unfortunately can't be with us today. But yeah, we're an I call us our autism family, just because our son has autism and we've just embraced him. I guess we discovered he had autism when he was 3 years old, and there was his whole story behind that and journey and so on. But since then, I've been blogging about autism. Just, you know, my whole life turned upside down. I just no more lawyering, no more attorney. I just focused on my son and blogging and just being an advocate for autism. So that's a little bit of my story. Yeah.
Right. So I'm going to ask you to go a little more into that journey and share whatever you'd like to share from the beginning, the middle, now, whatever you're comfortable sharing.
So we actually left Jamaica when my son was 18 months old. We we migrated to Canada for my husband's job. And at the time, all things were going well. My son was developing normally, and we had no issues, no concerns. And I had said, you know, I'm going to Canada with my husband and I'm going to take some time off work, maybe a year, and just spend time with my son because, you know, I could do it. Why not? And then while we were there, I noticed the communication wasn't coming as quickly as I thought, you know, and I mentioned it to doctors and my parents and, you know, is this okay? And he's a boy, it's fine, you know, give him some time. And you know, as the months went by, closer to now, like age 2, I realized that, you know, it really was not coming together. The language, like his peers, got him into a preschool and still not, the language wasn't coming. So the teacher at the time, she showed us his form and said, well, he's not doing this, he's not doing that, and he won't sit still. And that was a big red flag as well. He wouldn't sit still. He was just very busy and busier than any toddler. And we said, you know what, we need to check this out. And we went to a developmental pediatrician, and this is by age 3 now, we got the official diagnosis that my son had autism. But before that, he was doing speech therapy because we just figured it was a speech delay. But we got the official diagnosis when he was 3. And since then, it's just been therapy after therapy. And there was no more going back to work because, as you know, when you migrate to a different country, there's no support. Well, my parents were here in Jamaica. My husband's parents were in Jamaica as well. We had no support. So it now fell on my shoulders to take care of my son, take him to all the various therapies. And, you know, the blessing was that we were in Canada. We were able to access services. So, I mean, even though we didn't plan to have autism, it worked out that we found out in the right place at the right time that we could access services for my son. Let me tell you, his diagnosis was, he was a little bit verbal. As I said, the communication was there, but not as forthcoming. And so we had to go through speech therapy just to get him to tell us what he wanted, which is like a one word, you know? And let's see, so it's been what, 10, 11 years since his diagnosis. And I have to say the communication is much better. But not only that, we now know him, like we've connected with him, and he can tell us what he wants, and we know what makes him excited, which is music. Just like how Rossi with the Powells, his thing was art. My son loves music. And once we figured that out, we were able to make a connection, you know, and from you make that connection, you can build on your communication.
Right, you're working with his strengths.
Yes, exactly, exactly. So I mean, that's pretty much our journey, just discovering our son and figuring out what makes him tick and just jumping on that and building on that.
Sure.
You know?
Thanks for sharing that. And so what's the extent of the support you got in terms of treatment for him, psychological support, spiritual support? What was that like?
So for him, he got speech therapy, occupational therapy, ABA therapy / IBI therapy. And I like to say he got music therapy, but it wasn't music therapy in its truest sense. It was just me recognizing that music was the thing for him and just throwing him in it. And he, I don't know if you know, but he's my little drummer boy. He loves drumming. That's actually the name of my blog, Diary of a Drummer Boy's Mom. And it's like it's a part of him, rhythm. And he not only likes drumming, he likes piano, he likes guitar. If he could learn all the instruments, he would learn them all. But his main love is drumming. And so we just put him in front of a YouTube channel with all the drumming videos, and he taught himself how to play the drums. And we just, there's nothing like music. Let me tell you, it's like the best thing. Music is his language.
Wow.
And so we have just held on to that. So I call it our therapy, because music has been our lifeline, and it has also been his lifeline. And we just built on that. So that's the extent of his therapy. And with me and my husband, I can't really say we got formal therapy. We had a lot of prayers, a whole lot of prayers. I mean, I have a praying mom and dad and my mother-in-law. I know they pray for us. The good thing about us as a couple is that we while it was hard living away from family, it forced us to just connect and just rely on each other, and we had nobody else but each other. And so I think that was our therapy.
Right.
I don't know. We didn't have
kind of like what Basha said.
So I mean, we just became so close, and whatever I was feeling, I'd tell him same thing. He'd tell me, and we just came to a point of just brutal honesty. I'm really having a rough day, so am I, and let's just fix it together, and that sort of thing. So yeah, that was it.
Powerful. Thank you so much for sharing that. And before I finish your segment, what advice would you give to other families and their supports, their relatives to help them along this journey?
I mean, there's so much advice I'd want to give, but I want parents out there to remember that they're not, or to know that they're not alone. Uh-huh. You're not alone on this journey, this special needs journey, this autism journey. There is a community out there. Find it. There is JASA in Jamaica that I know of. Connect with them. And you recognize that there are families out there that you can just, you can get emotional support, or just, you've been there, I've been there, and, you get that sort of support. I would also say, you have a village. You have that village, you have your tribe, you have your family. Let them in. I know sometimes in Jamaica, you have a special needs child, you don't want to talk about it, people, your friends, your family, they want to help. Maybe they don't know how. Show them, teach them, whatever it is, and let them in. Because at the end of the day, you're going to need them. You're going to need time away with your husband, or, with another sibling who may be feeling like, wait, what about me? You're going to need the support, somebody that you can trust to say, hey, can you watch whoever your child is who has autism? Can you watch him for me? I need some time. You're going to need that. And I would say, don't try and change your child. That's not what this is about. You don't want to change them. God never made any mistakes here. Okay? No mistakes were made. This child was born for a purpose, and you just need to figure out what that purpose is. Pray, ask God to guide you, help you to figure out why he gave you this gift, because a child is a gift, and figure that out. And it's not about changing them. It's about figuring out how you can bring your child to his fullest potential, whatever that is. And the only way you're going to figure that out is by spending time with your child, connecting with them, and building on that connection. So that's what I would leave.
Yeah, thank you so much. Thank you so much. And you two are welcome to stay, or, you know, whatever. All right. Thank you so much. So we'll get to the specialist now. Dr. Watson Campbell, I'll start with you. Can you please tell me how you define autism spectrum disorder and how is it classified?
Okay, thank you so much for having me. And I just enjoyed listening to the parents. And I would add to that, you know, sometimes this experience actually can pull families apart. So you have to find a way to be together. All right, so autism is on a spectrum. It's a neurodevelopmental disorder. And what I mean by that is that it's really about the way the brain processes information, and how that, you know, and how it is interpreted. You always have associated with this autism global developmental delays or delays in some specific areas. And I think we heard mentioned communication as one of the main areas that is picked up initially. The diagnostic manual that is used, the DSM-5, actually also includes sensory deficits as one of the things that you are likely to see with a child. So how the child is getting sensory information to the brain, how that information is interpreted, and again, how that impacts on their behavior. So, you have social and communication and behavioral challenges. But as was mentioned before, you also have other, I think you said it, Dr. Arusha, they are usually, or not usually, but they are sometimes accompanying conditions. And as an occupational therapist, one of the things that we see is also motor-based problems. This child may have coordination problems and so on. But for us, the sensory issues also is a very big thing. And it's on a spectrum, as we said. So you have the mild, you have moderate, and you have the severe presentations. So, you could have a child who is quite mild and you wouldn't be able to pick up that anything is really going on with that child until you probably try to see that you try to have a conversation with them, or you have observed the child for a little while and you see how detached they are from other persons, or, so it's not always understood right away that there's something going on with that child because it's not something visible that you can see. On the other hand, you have some children who are in the more moderate to severe range who you would know right away because they can't keep still for a minute. They're all over the place. They probably make a lot of sounds because there's some self-stimulation going on. They're really not connecting with what is going on around them a lot of times. So they do stand out, if they're in an area, and especially if you take them into some space that they're not used to, you will really see those behaviors being exaggerated. So you have on the mild end, those children who, in fact, it's a group of conditions that they've now called autism spectrum disorder, because you used to have, for example, the Asperger's syndrome. And so you would hear that those are high functioning children, but everybody is on the spectrum now. So you're mild to severe. But in the mild lot, that group, as we are saying with the Asperger's ones that used to be, they can be very gifted children, and can do well academically as well. And we hear about them being inventors even, and being great artists and so on. But where we always seem to see that issue is how they are able to communicate probably what they, what they know, how they can build relationships. That's one of the things that I see even with the ones who I've been working with these children for 30 odd years. So I now know some of them who are adults. And you see that this is one of the things that still remains a problem, that whole thing of connecting with people. And so that is something that has to be worked on, in a very definite way. So yeah, that is how I would probably explain what this autism is all about.
Thank you so much for elaborating on that for us. And I'll go to Ms. McIntosh. Can you give us an idea, if you're aware, of how common autism spectrum disorder is in the Caribbean, and what are some of the risk factors and causes, if we know, for these conditions?
So there is a growing, the autism spectrum disorder is really growing in regards to being diagnosed very often. There is no set prevalence in terms of stats, in terms of numbers across the Caribbean, in terms of how many we've had from 2010 to 2020. There've been some research in Aruba that shows the increase, but we don't have any real numbers. I know in the Bahamas, we had a clinical psychologist that I think it's been about 6 or 7 years ago. From her working, she found at least 7,000, but we know there's a lot more than that. So we know it's increasing because we are now aware of the characteristics and the symptoms. Before, we weren't quite sure what was going on. We know these kids had some difficulties, they had some issues, and we were maybe misdiagnosing them with other things. But now that we have a criteria that we follow, a lot of kids are being diagnosed from an early age. And a lot of it has to do with developmental delays. Parents are now starting to pick up, like Ms. Noel said, but he's not talking, or he's not doing this, and he should be a little bit further along. So parents are now starting to pick up that, things are not going the way they should be going. Let me go ahead and look for help. No one really knows for certain what is the cause. There isn't one specific cause that can be identified. So research suggests that there are a combination of different things like genetic and environmental influences. So some may be in terms of a mother during her prenatal stages being exposed to toxic chemicals like pesticides or viral or bacterial infections. There's an increase when there's either parent is advanced in age. When there's a mother or a brother or a sister, someone in the family that may have already been diagnosed with ASD, there's a higher risk of that in terms of genetics running in the family. And we spoke about some other conditions as well, if a kid has some other conditions. So other conditions like Fragile X syndrome and tuberous sclerosis have been closely linked with kids developing autism spectrum disorder. And what's so very interesting is that boys are 4 times more likely to have ASD than girls. So you will hear a lot of parents with their sons being affected with autism. But there's a lot of genetic and environmental factors, but no one can pinpoint for sure what is causing the increase or the rise in autism spectrum disorder.
Okay, thank you so much for sharing that. That's interesting. Any clue why boys, or that's just how it is? Why boys are more commonly diagnosed than girls?
No one really knows. It's just, that's how it's happening.
That's just how it is.
That's how it is.
But can I just say though that is not unusual for conditions overall, because certain conditions, because if you're talking about ADHD or a learning disability, it just seems that there are more boys. I don't know if they're picked up more quickly, because they tend to act out a little bit more, but it's in other areas as well that you're seeing that.
Understand. And so Dr. Watson Campbell, I know you mentioned some of the clinical features. Would there be anything else you'd want to elaborate on in terms of how ASD may present in a child? And then Ms. McIntosh, you can tell us in adults if there are any differences.
Okay, so I think Mrs. Noel was referring to some of the things already, but I would just point out that that whole thing with communication is a big thing. And what it is really is language is both expressive and receptive, okay? So you're looking at trying to get them to speak. That's one of the things that people want. You know, I think you heard earlier how ecstatic that couple was when the child started to say something, you know, use words. But one of the things that we have found as well is that they don't process language very well either, okay? And this is what affects them in the academic world as well. And these are some of the higher functioning children I'm talking about. So the more they get on into, you know, like the academic world, this thing seems to affect them. And this processing of language, I think, is not just in terms of academics, it's about their social interactions as well. Because if they're not processing and following like a conversation, you know, I hear from parents sometimes that their child who is like a teenager doesn't have any friends because they can't, you know, follow a conversation. They thought the friends reach at X and they're still talking about A kind of thing. So that processing and keeping up with conversation and in understanding language concepts, that affects them quite a bit. I would also like to highlight, I think, the sensory.
I think she's frozen.
Right. So what
I lost you a bit there. Go ahead.
Oh, I'm sorry. So as occupational therapists, Shanika will know that we talk about sensory integration dysfunction as being a big thing with these children. So what happens is that the way the brain is processing the senses, you know, the sensory information that is coming in, it's either that they're overreacting or underreacting. So things like, you know, things that they eat, things that they're able to even hold on to. You find that for the children in school, holding on to a pencil to write is a big problem, you know. So there are sensory issues, responding to the different types of sounds that they hear, you know, is a big thing for them as well. So either they overreact because of that, it's too much, it's overbearing. So yeah, I would say sensory integration is a big thing for them. And I would also talk about the fact that they have very narrow interests, but they do very well with the things that they know. So they know everything about like airplanes, for argument's sake, but they don't know about anything else, you know. And so that's one of the things that we try, even as therapists, to help them to broaden the range of things that they can interact with, you know, in terms of interacting with other people and with their environment. Yeah, so, and I guess I would also mention the emotional things. I kind of alluded to that before, but that's a big thing as well, because I think quite a lot of the children can't empathize is a problem with them. And so they don't understand how other people are feeling about something. They don't understand why it's such a big deal, whatever happened. And they can come across as having kind of a very flat affect, you know? And so they don't, you know, apart from the few things that they really, really like, everything else is kind of to the side, you know. So those are some of the things I think, the repetitive behaviors, rehearsing what they hear, you know, and excellent memory. Oh my goodness, excellent memory for probably what they have seen and heard, you know, but putting sense to that, using that information so that they can be quite functional and do well even academically is a big problem. So those are some of things I would talk about. Shanika can tell you about the adults. Yes.
So I just want to start by saying that autism spectrum disorder may look different for every child. It's not the same across the board, and that's why it's a spectrum. And then we also have to take in consideration personality and resources and being prepared to transition from teenage to adulthood. So I think I would generally say in the Caribbean, we've been struggling with transitioning our kids from that teenage, being in school, into adulthood in regards to emotional contact that Dr. Watson Campbell spoke about, social in regards to being able to follow social commands and social expectations, to functional things like going to work or having a skill or even going to tertiary education. We tend not to look at those things. And I would even throw it out there as well. To some of my parents in the Bahamas, I've really been working on training in regards to self-care for our young girls that may be on the spectrum in terms of what the changes in their body and menstruation and all of that we don't think about. But kids with autism, their body goes through the same changes like everyone else, but because of their processing, interpretation, as well as sensory, which is important, we have to kind of consider, we're not really thinking about how they're going to transition and adjust to some of those things in adulthood. So those are some things that adults with autism may face, as well as, and I'm going to say it, maybe sexual orientation and having a partner. Remember, not all of our kids are high functioning or low. There's a spectrum. So some of our kids may be able to have a relationship or have a boyfriend and girlfriend. They may have some understanding, others may not. But we have, those are still issues or difficulties they're having in terms of interpreting, in terms of training, in terms of understanding what is going on, specifically in the social context and specifically in work skills. What's so unique, and I think Dr. Watson Campbell would agree, what's so unique about occupational therapies, we look at our kids, our adults, our clients through a holistic perspective, meaning there's more to you than just physical. We know there's cognitive, there's sensory, there's visual, perceptual, there's gross motor skills, fine motor skills. We're looking at being reintegrated into the community and being able to catch the bus or drive, or being able to function in kitchen skills and all of those stuff. At the end of the day, we want our adults, we want our children to be able to be as independent as they possibly can in life. Period. It's not about having an A grade. It's about being able to feed yourself, being able to communicate your needs and wants. And it may not be verbal, it may be nonverbal. We have so much technology now we can use in terms of communication, but the end goal for all persons with autism spectrum disorder or any disorder diagnosis is that we want them to have the best life they can have and be happy, have the quality of life that they can have. And that's important with adulthood, especially adults with autism spectrum disorder.
Thank you so much for sharing that. And so I think we can also go right in now, Dr. Watson, to speak a bit about what sort of treatment is there for persons with ASD and how widely available is it in your country. So Dr. Watson Campbell, you can give us the Jamaican perspective, and then Ms. McIntosh, you can tell us from your perspective in the Bahamas. Okay, so I think you've heard it from the OT point of view already. So very much we, are needed, one of the needed professionals. But we also need persons to do ABA, applied behavioral analysis, other behavioral interventions. We need persons to work with their speech and language, and we're talking about speech therapists there. You need special educators, or teachers who really do understand how to work with these children as well, because some of them can be in regular schools, but, they need persons who understand what to do with them. The thing is that in
my country, I'm supposed to be talking about, there's a dearth of persons who can offer interventions. And this is something that is just really so hard because you see where the children can be exposed, how well they do. You know, I always say that to my parents, you know, taking them into like an education program and them learning to read and write is just part of the story. Learning their life skills, being able to socialize, to communicate, and so on. So we don't have speech therapists here nearly enough. There are like about 5 in the island. Don't even mention occupational therapists because there are 2 of us who work with children, you know. And so I think, and even for the special educators, trying to find, you know, teachers who are trained to be able to work with these children, it's really bad. So I would say in Jamaica, we haven't even started yet to really meet the needs of these children. There's a lot that needs to be done in providing these professionals.
And if I may also ask, how, I know with COVID, a lot of things have gone online. Is this an opportunity, or how practical is it for us to access specialists in a virtual setting?
Well, I know that at the McCam Center, we try to do occupational therapy. We have some sessions online. However, that a lot of that depends on the support that the child has at home.
Right.
You know, so that parent has to be there and in a position to do that. I think there are some of the speech therapists who are doing that as well, you know, and I know there's one. I don't think there's ABA online as yet. I haven't heard of it. Okay, but what I would even say from the educational side, because McCam has an inclusive early childhood program, so I know I speak to the principal, and I know that there are some of the children who are online, and all of them were online to begin with. Some of them, the parents just stopped trying to help them because they just couldn't cope with, you know, keeping up with the program and keeping the child focused and all the rest of it. So for them, they just wanted them back face to face. So some of them have started to do that now. And some people have just gone out and had, you know, employed people to come and be with the child and help to guide them through the programs, you know, that they can have online. But not many people can afford to do that. So it's not a very easy thing, I think, to offer this program to the children online.
Understand. Wow. Ms. McIntosh, can you give us your perspective from the Bahamas?
I think over the last 10 years, we have increased in terms of specialists, but it's still not nearly enough for what we need. We have quite a few clinical psychologists and a pediatric neurologist that assist in diagnosing. The thing is with that, a lot of them are private, and a lot of our parents cannot afford the cost for some of those assessments. So our public healthcare system could really use a bit more specialists that will assist in not only diagnosing, but we need the therapist, as Dr. Watson Campbell says, in order to transition. Because after you've been assessed, what happens? And I think a lot of parents are frustrated because, okay, now I know that he has autism spectrum disorder. Where do I go? What do I do? Who do I go to? And if you only have like 3 or 4 persons and they're all private and it's costly, you know, the child isn't getting the assistance that they really need. So we have increased, we still don't have nearly enough. I think we have like 3 ABA therapists, 10 occupational therapists, and about 8 or 9 speech therapists. But what's so unique about the Bahamas is we're a chain of islands. So you have to go by boat or you have to go by plane to the other islands. And all of the specialists are on one island. So we're not really meeting the needs of the other 30 plus islands of people on those islands. So that posed some difficulty as well. But we have increased in a number of specialists.
Well, thanks for sharing that perspective. And I'll say on you, Ms. McIntosh, can you tell us What else do you think the authorities can do to help, as well as do you recommend any support groups? Are there any that you can mention in this forum?
The authorities can do a lot more, but I don't think we want to open up that can of worms, because we'll be here all day of what we can do, right? I will say this. I believe that our government and our healthcare professionals really need to take a look and take persons with autism spectrum disorder very seriously. I think we've neglected them for far too long, and now we're coming into an area where autism spectrum disorder is almost like a pandemic in itself, because no one is really paying a close attention and really creating the resources that they need. And our parents are so frustrated, and our children are just passing by and not getting the assistance that they need. So we first need to really identify, we need to come to the knowledge that it does exist, and we need to do something about it. We have an organization here by the name of REACH, and it is the pretty much governing body of support group for parents that have children with autism spectrum disorder. They offer training, not just a support group, but they offer training. They offer daycare services during their meetings. They offer resources as best as they can to help those parents and to help those children with whatever they need. So that would be the biggest governing body in terms of autism support and training resources and information.
Thank you. And I guess a lot of that would be in person. Are there any sort of free resources online that you can think of that can help support such families?
Resources in regards to what specifically? Occupational therapy?
Any kind of support, even a support group, or, you know?
I can't think of anything right on the spot. I don't know if Dr. Watson Campbell will be able to assist in an online support group, but there's so many support. I was doing some research, and there are so many support groups in Jamaica alone. I didn't realize that they had, you know, a number of persons really fighting and advocating. So I'm sure that there is support. A lot of people may not be aware of them, but right now online, all over the world, you can join support groups on Facebook, on Instagram. There are lots and lots of support groups, but I don't know if anything specifically online in the Bahamas.
Okay, thank you so much. Dr. Watson Campbell, can you pick up?
Yes, I would say that before I talk about the online, I'm a little unstable. Are you hearing me?
Hearing you loud and clear, thanks.
Okay. All right, good. So I would probably say that not online, but the government is really trying to do, you know, quite a bit, I think now, to, you know, set up services. So we have an agency called JCPD, Jamaica Council for Persons with Disabilities, and they will give quite a bit of support. Once a child is diagnosed, the child can register with JCPD, and I have known of parents getting support for their children through that means. I know that the special ed department at the Ministry of Education, people can also, you know, get help through that means. They actually help to pay for fees for some of the children for, you know, in school. JCPD helps with the therapy fees. And also people should remember, if they have insurance, right? A lot of people don't realize that, but they can actually apply for payment of interventions, sessions, therapy sessions through their insurance companies, depending on the I suppose the particular policy that they have, but they can get help, and it's not for very long, but even if it is 30 sessions that they are going to pay for. So there are some things that are happening here. The online things, I don't know what JASA has. I know that McCann Center tries to do some things online as well. I think Mrs. Noel was talking about being a blogger. I don't know, here in Jamaica. So I'm sure if parents need some kind of support that way, you know, they can also, she spends her time just trying to find where some resources are. So there are some things that are happening, you know, not so much online that I can talk about, but there are some things that are happening here in Jamaica, not nearly enough with the specialist people not being available, but the other support services.
Thank you so much for all the work that you guys continue to do under difficult circumstances. And so, Dr. Rose, perhaps you can pick up here and mention if you know of any other support services that are available for such families.
Good afternoon again,
I mean,
everyone.
Miss Rose, I'm speaking it into being, eh?
So maybe in a year, Arusha, because I'm yeah. We've come a far way in Jamaica. I mean, when I came to the West in 2005, there were so many things that were absent and families really struggled. When I completed graduate school in psychology, my aim was to become a forensic psychologist. And when I started out in the public healthcare system, I kept having these kids that were turning up in the clinic that for whatever reason were being missed and met the diagnostic criteria for autism. It was very startling to me at that time that there were so many persons that were not being picked up by the system because their symptoms were very much present. I remember one that hit home with me was a gentleman, a farmer, that had walked to the clinic from Upper Trelawney. He had come from a very far distance. And the child was 12 years old and he was in diapers, he was nonverbal. He had a lot of self-injurious behaviors. And he said, somebody told him that if he came to the clinic, he would find this lady that could help him. And that lady was me. And I felt very defeated as a professional because as Ms. McIntosh alluded to, I could tell him that his son had autism, but I couldn't do anything else. And that didn't feel very good to me as an individual. So I think I got drafted into childhood developmental disorders because of these families that I was meeting. And about 3 years ago, I went back to school. So my PhD is in child and adolescent mental health with a focus on developmental disorders. And what I found over the years, so as Dr. Watson Campbell alluded to, there are a lot of social services that are available to our families in Jamaica who might have children with disabilities. So it's not limited to autism. What I find the biggest challenge is, Arusha, is getting the assessment. So that's the first hurdle, because once you've completed the assessment, there are a lot of doors that you can knock on. So you can go to the Ministry of Education, you can go to Ministry of Labor and Social Services, they will assist you. You'll get registered with Jamaica for persons living with disabilities, and they will pay for, so I know our Ministry of Education currently pays the full tuition for registered and approved special education schools. So that's a great feat. So in the West, we have Montego Bay Autism Center and we have NAS Children's Center. Those are two of the more prominent ones. And of course, we have our special education schools that one is located in each parish, but it goes without saying that one is insufficient. And I think a little bit to what Ms. McIntosh alluded to, we have a similar issue. Many times these places are located in the cities. They do not account for the very rural parts of the island. So if I live in Upper Trelawney or if I live in deep rural Hanover or Westmoreland, and there are other places around the island, there are not many services available to me within my community. So you can't expect as a parent who's going to travel 3 hours to school and 3 hours home when they themselves need to be employed to meet the other needs of their children. When you think of a 12-year-old who is not potty trained, who is nonverbal, I heard the Noels and the Powells alluding to the fact that they had to modify their lives. You know, Miss Noel said she gave up her career. She wasn't complaining. She gave up her career to be that present parent for her son. And many parents who have children with any exceptional need are put in a position where they have to give up their careers to provide for their children. Because I often hear parents say to me, Miss Rose, but my child can't tell me if anyone is doing anything bad to them. They can't tell me if someone is abusing them or hurting them. So, you know, the fears that all of us as parents have and the luxury that we have is that our children grow into themselves and can communicate if they are being abused or hurt. But children with exceptional needs don't always have that privilege, because not every child is going to become verbal. And I just want to pinpoint that not every child who is delayed in speech has autism. So we always have to be conscious of that. There are a host of disorders that can affect development or interfere with development. One of the things that I am a big supporter of or proponent of is to be respectful of individual differences, to acknowledge that children develop at a different level and pace. I have met children who first speak at 6 years old and they do not have autism. Many times children come to me who have language impairments and they are okay on all other domains. And the parents are convinced that they have autism and someone else would have told them that it's autism. And I spend a lot of time explaining that that is not the only criteria to use to make a classification and diagnosis of autism. We have to be patient with children and give them the opportunity to grow and develop. We meet children where they may look like autism, but it might be sensory deprivation. So they may come from environments where there's not enough stimulation and there is abuse. And the literature and the research tells us that the neural chemistry or the neural architecture in the brain is significantly affected by abuse and deficits in stimulation. And different families have different challenges. So, you know, just to be aware of those things. Mrs. Watson-Campbell spoke about the paucity of occupational therapists and speech therapists and clinical therapists and any therapist or specialist that provides supportive services for families of children with exceptionalities such as autism. And I just have to say, it gets even worse when you go into rural communities. So I find that when we do invest any money and when we do provide any support, we tend to, like Ms. McIntosh, we center it in one place. So we may not have many islands, but we have many parishes, but everything is in Kingston. Most things are in Kingston, and then there's splatterings of things in other places when the island is made up of more than Kingstonians, and I'm a Kingstonian. So, you know, I'm not bashing us in that sense, but those are some of the struggles that our families are faced with.
Thanks for highlighting those realities, Ms. Rose, and thanks for the work that you continue to do. So you touched on some of it, but perhaps you can elaborate a little more on what are some of the emotional and psychosocial consequences for families and persons who have ASD.
So there is a term, I think, I don't want to misquote, but I think it was Dan Stern that spoke about when you become a parent, there are two things. There's the baby in your mind and the baby in your hand. And when you have a child that meets the diagnostic criteria for a developmental disability such as autism, some parents have a difficulty reconciling that baby in their mind and that baby in their hand. All of us who desire to be parents and ultimately become parents have these ideals about what our children will be. We have a way we want them to look, and we use that to influence the partners that we choose. If you're like me, when I was pregnant with my son and my first son, you know, I would have these dreams that he never was in physically, but I would hear his voice. I was preoccupied with how he would sound, you know. So when you become a parent, there are these romanticized expectations of what parenting is going to be. I think it was Basia saying, you know, we're taught to be these strong, brilliant, we're overachievers. You know, Caribbean women are known to be overachievers. You know, we have to be on top of everything. We have to shine, and our kids have to shine along with us. And when we have these children that do not meet these typical standards, it can be very difficult. And I love the authenticity that Mrs. Noel and Ms. Powell brought to the table today, because I don't think we have these very honest conversations all the time. We sometimes are meant to feel guilty if we say it's difficult. We're sometimes made to feel as if, you know, sometimes if we have, you know, we're very Christian minded on our islands. And if we say, by God, we are chastised, how dare you ask that question? Be blessed, be grateful. And the reality is that we don't feel very blessed in those moments, and we don't feel very grateful. And you find that it's a roller coaster for most parents. I find it has there are a number of variables that will impact how families cope with having a child with exceptional needs. One, what is the degree of disability? So we know that autism is on a spectrum, and some children are at the higher end of the spectrum. Many of you're specialists in this field, including you, Ms. Noel, because you have a child with it. So in my opinion, you know more than me. That's always my philosophy. The patient comes in as an expert because they're living it and I'm not living it. So that is the reality. But many years ago, when I was just being taught as a clinician, autism was a part of a group of disorders known as pervasive developmental disorders. I actually prefer that categorization, right? So when they changed it in about 2012, and they called Rett's disorder, childhood disintegrative disorder, and Asperger's syndrome autism, there were a group of parents that were not pleased with that. Because many parents, or some parents, saw autism as being at the extreme end of the spectrum, you know, classified by marked impairments. And Asperger's was at the top. And these were or brains or brilly brains, and they liked that diagnosis. You know, so when we lumped everything together and called it autism, some families were not pleased. So one of the issues that really impacts on how parents accept the diagnosis, process the diagnosis, and cope with the diagnosis has to do with the degree of the severity of the impairments and how those impairments affect quality of life. Because if you have a child that is diagnosed with autism and the only challenge they have is speech and language, but they're able to be around others and taking sensory information, and they're not engaging in self-injurious behavior, and they're potty trained, and they have a vast palate, then for the most part, you can manage. But on the other side, you have a parent who has a 4-year-old who's not potty trained, who is earning minimum wage, still has to be buying diapers. They can't have this child integrated into regular school because they're not potty trained. They have a restrictive palate. They only eat Fruit Loops. Fruit Loops is not cheap and it's not the most nutritious. So then you have a parent that gets very overwhelmed because it seems as if the demands are so much. And then it segues into the other part, the support system. If you don't have a very good support system, then it makes it that much more difficult. I remember once at my private office, I was going up the steps. I was going up the steps. I think I was going to the office, and I happened to come upon a client who went to pick up an assessment, and the assessment had autism spectrum disorder as a diagnosis. And I saw this woman in tears, bawling down the place. And I said to her, you know, what's happening? What's wrong? And she says, I can't take this home, Miss Rose, because my family is going to just reject me and my child. And she says, everything about me is so bad already. And here it is going to be one more thing. I can't even have a normal child. And I had to walk her back in the office, delay all the other patients. And she says, can you just take it off the report? I can't take it off. You know, I can't take it off. I'm so sorry. And I mean, my heart really felt for her. I had another client in public practice where when the diagnosis was given, she walked out and left the child in the office. She says, I don't want him. I don't want him. And, you know, there are people in the office that were very upset, you know, you're a poor mother. And I had to just say, let's just chill and give her an opportunity to process it. You know, it has a lot to do with our resources and our support system. And once again, what this diagnosis means to us. You find that the diagnosis can pull some couples together. Mrs. Noel and Ms. Powell spoke about that, but it can also divide some couples. Because if you never wanted to be a parent in the first place, and most pregnancies are unplanned, if you don't have a lot of resources, and then you're now put in this position, if the relationship already had challenges, and now this is a new challenge, you find that it can really divide parents significantly. So it varies, and once again, it goes back to the family support. You know, are you invited to family events? Is your child included in things? You know, will your child be invited to birthday parties, to the neighborhood events? Or will you be like, you know, in the bygone era where if you had a child with any disability, they were locked away and you didn't know that they existed? That was a reality in our society. It still is a reality in some communities. Spiritual support, families that have a faith, and it doesn't matter what the faith is, whether it is Buddhism, you know, Christianity, Rastafarianism. Families that have a faith tend to do a lot better whenever there is a challenge that they have to face. So that is another variable that we take into consideration.
Thank you so much for, you know, sharing those stories. I mean, being so real with how it can impact, you know, families. And I keep saying on my shows that we have to get better as a people with empathizing and supporting, you know, not casting judgments, not making a situation worse, but just supporting. So what types of psychological treatment and support is available for families and persons with ASD?
So we just want to reiterate, Arusha, that there's no cure for autism.
Yeah.
As of today, we might wake up tomorrow and there may be one. And that's what I always say to my family. So we want to have hope. There are lots of treatments that exist. And I usually say to parents to do your research. One of the recommendations we have is to seek out treatments that are backed by credible universities, peer-reviewed journals, and notable organizations. The reason we say this is that if you go on Google and you type in autism, a wealth of information comes up. And we have to remember that marketing is a strategy and anything related to children is a business. So many families have their vulnerabilities preyed upon and they can be fleeced out of their life savings trying to find this cure that as of now does not exist. And I say this because it segues into the point that there's no gold standard treatment, Arusha. And I think everybody has to be aware of that. There are empirically backed treatments out there, but there's no one that meets all the demands. So ABA is one of those that's leading right now, but it also is not without its own controversy. So ABA employs a mixture of reinforcements and punishments. And there has been a lot of backlash recently in the media, persons who have gone through ABA who are saying they were victimized and traumatized by it. So families have to be mindful of the use of ABA and what is being employed with working with their children, because we also have to manage our expectations. I know families, local families that have traveled to first world countries in North America and spent millions of dollars on treatments that last for maybe 8 weeks or 12 weeks. And the clinician in me, I don't see any meaningful changes in their children. I stay away from those conversations because I recognize that it is a very personal journey and it's very sensitive. But I always say to families, be mindful. So we have to understand what are the goals that we have for our children. I think Ms. McIntosh said something very powerful. Do we want our children to have 10 CHCs or do we want them to develop life skills? Because I remember I had a family, when I do my assessments, we have an intake, a very rigorous intake. And I asked a lot of questions and I was going through the functional capacities. And I said to the mother, tell me about his self-help skills. Can he, this kid was about maybe 8 or 9. Can he brush his own teeth? And she said, no. And dad says, how do you know he can't brush his own teeth when you've never allowed him to brush it? And she said, but Miss Rose, I don't want him to have a smelly mouth. And I said, I agree. Let's have a compromise. You brush it in the morning, let him brush it in the evening. So you can tell me the next time if he can brush it. When she came back, she said, you know, I can't brush it, Miss Rose, you know? So I had to say to them, the reality is many of our children with ASD are going to outlive their parents. So when you have left them behind in this world, what are the functional skills that they need to have to be able to survive? So we have to, we must have hope and we must have faith, but we don't want to chase things that have not been proven. Because the time we take chasing those things, then we rob our children of the opportunities to build their capacities. So we have ABA, we have occupational therapy, we have nutritional therapy. Because
just highlight what ABA again is. I think it was mentioned earlier.
It's the applied behavior intervention, right? So, there are a lot of alternative therapies. In fact, research tells us that about 75% of families with children with autism engage in complementary medicine. And what we found is that the more educated the parent are, the more likely they are to use complementary medicine. So that's quite interesting.
Interesting.
Yes, because they believe it is harmless, but that's not necessarily true. So there's a big thrust now for the gluten-free diets, but not every child with autism benefits from that. And there is no empirical data to tell us that gluten is the cause of autism. Linked to that. There is, functional capacity, social skills development. The primary belief right now in the scientific community in terms of interventions is education. Special education is our biggest thrust. And that's what I encourage parents to engage in. If anything, if you can invest in anything, invest in the special education. There's social skills interventions. So you look at what the impairments are. Is it making eye contact? Is it the reciprocity? And reciprocity is you come in and you say to your child who has autism, how was your day? And they say, my day was good. And the conversation ends. You want to encourage them to say, okay, ask mommy how was her day now. So you want to build that capacity, the social capacity. So that was another criticism of ABA, that because ABA is entrenched in behavioral therapy, it's environmental strategy. It comes from the principle that all behaviors are learned and all behaviors can be unlearned. So wherever you see a deficit, the child has not learned it for whatever reason. There's the argument that the neural connections were not made in utero for whatever reason. Maybe mom was exposed to a teratogenic substance, maybe something coming from dad's DNA, we don't know. So they're trying to bridge these gaps. But what we have found is that even children who demonstrate language as a result of ABA, it's still not communicative.
Wow, thank you for shedding light on that. And lastly, I'll ask you, what advice would you give to family and friends to help them support other, the families with ASD?
To be our brother's keeper. I think COVID has reminded us about the humanity of us all, that, we cannot survive without each other. And, to just be a listening ear and a helping hand. We may not have the magic to change the challenges, but just being present, just listening and loving and supporting these families, that makes a big difference. And respecting people's rights to feel the way that they feel, and not trying to feel for them or telling them how they should feel, and allowing them to just have you as that, that anchor through this journey of parenting, because it's not easy for any of us. I think makes a world of difference for families.
Definitely. Wow. Thank you so much, all of you, for sharing. I know our Facebook audience has been very patient. We'll take some more comments, and you can also type in any more questions that you have. And I see Francine, mommy, Pastor Diane says, my daughter and David Noel, her husband, they have done an excellent job in raising Zachary. Kudos to them as they embraced his diagnosis and they loved him. We also have, welcome Shireen Wisdom and Tashiana Collins, and Kimberly Nugent McFarlane mentioned about JASA as well, Jamaica. So, that is Jamaica Autism Support Association. And kudos to you guys, Ms. Chang, and all of you for the work that you're doing. We have Nikita Mulling says Dr. Watson Campbell diagnosed her son, and she sends a hug emoji. We have Norma Chambers saying love and blessings, Francine, David and family, also to the other families who are on the same journey. Keep the faith. He made everyone in his own image indeed. Auntie Janice in the US says, my grandson now, CJ, is now 19. He will not be volunteer to talk. He communicates with the help of a computer, but if you tell him to say something, he would. He is a computer whiz now, wow. He is diagnosed as profound, and we had to get used to his mannerisms, wow. Talk about acceptance, eh? And Cook says, my son just turned 3, not diagnosed, but I can tell he is autistic as per research. He displays many of the symptoms, will be going for assessment by the end of the year. And she's located in St. James. We wish you all the best with that. Davidia Trim says Trinidad and Tobago Specialist Education, Specialist Intervention Specialist. Thank you for the invite. We have Chrissy Phillips saying, my son is 7 years old, took him a long time to speak. Although he talks more now, he still has problems expressing himself. I'm still trying to get him to learn to read and write, which is very difficult, but he loves drums and drumming. Any advice, Dr. Watson Campbell, you'd want to give to this mom? Or Miss McIntosh or Miss Rose, anybody?
She says that he likes drumming, but he doesn't do what?
Okay, let me repeat. He's 7 years old. It took him a long time to speak. Although he talks more now, he still has problems expressing himself. and she's trying to get him to learn to read and write, which is very difficult, but he loves drums and drumming.
Okay, well, I think Mrs. Noel said she just let her son get on with the drumming. But yeah, I think for the parents to teach the child can be very difficult because you have to know what strategies to employ. And I think they should at least be guided in how they are trying to teach him to read and write. So that would be my advice to them, to seek help in that area, but to also develop the strengths. If he loves to drum, that is something that they can use to work with him as well, and continue trying to talk to him as much as possible, develop his skills as much as possible with conversations and so on. Yeah, but I would say they have to seek some support where that's teaching him is concerned.
Thank you so much. Anything anybody else wants to add? Okay, I think you covered it all. Jeanette Mighty, welcome, Doc, joined. My sister Mandela in St. Vincent joined. She says, good evening, everyone. Welcome, Mandy. Dr. Pauline, somebody is asking, where are you located? Your business, your practice?
Right, so I am at the McCam Child Development Center in Kingston here. And that is, they can find us online.
Sure.
And also I do have a private practice at Pediatric Place, which is at Burlington Medical. But the McCam Child Development Center is where I can be found mostly.
Thank you. And we welcome Michelle Baljo. Says, good afternoon to all. My daughter is 4 and she has been put on the spectrum by the specialist here. She's in Trinidad. She's not speaking as yet, but right now she is refusing to wear any undergarments. Pampers pull-ups is a no-go. Wow. She will put on an underwear, but immediately pull it off. Anyone has some suggestions, please, advice?
Wow. The Pampers, I guess, is a part of the toilet training. I don't know if it is something sensory going on, and if therefore that close fitting to the body is creating a problem, because some children who have tactile defensiveness, maybe even, they don't like to have things against their skin and anything holding them very closely. So if it is a part of the toilet training, she may want to try and do the toilet training outside of using Pampers. Just, use, I don't know, panties or whatever, and try to address.
I think we've lost your audio a bit.
Are you hearing me now?
Okay, you're back on. Yes, hearing you now.
Okay. No, I was saying that the toilet training is usually a big issue by itself. So I don't know if that is part of it, that she's trying to also do the toilet training. But there is a lot attached to that. The children don't like to sit on the toilet. They don't like to pass their urine or, have a bowel action. So I think she would probably need somebody to kind of, look at the profile of that child and see really what is going on. Is there a sensory problem? Are there other issues going on?
Okay. Anybody else has any other advice?
She can try rewards, so she can play around with the textures of whatever she's putting on the child. The different textures have different feels. But she can also try rewards, like we want to reward her keeping it on if that is your aim. So when she keeps it on, make a big deal about it and give her whatever there are a lot of nutritious and healthy candies and snacks out there. So if she likes that, reward her for keeping it on, and eventually that behavior might become what you want it to be.
Okay, thank you for that practical tip as well. Okay. We also have Chrissy Phillips saying, would really like to get in contact with someone in Trinidad. So do you guys have it, you know, after the show, if you know of colleagues in Trinidad, you can probably put up their contact name and contact info for their business. Miss McIntosh, Miss Dr. Watson Campbell.
Okay.
And then we have, oops, sorry. We have, okay, we have Cook saying, have you tried putting on the pam? Oh, she's trying to give advice as well, putting on the Pampers back to front so that the tabs are pasted in the back instead. Okay, we have Kellyanne Campbell saying, okay, so somebody answered where you're located, Dr. Pauline Watson Campbell. All right, and she gave the number of the business place. All right, so we also have, wow. I offer Valela Felicia, sorry for messing up your name, says she offers private therapy for ABA via telehealth currently. Please PM me for information if you're interested, would love to help. And that's our teacher, Valelia, on Instagram. All right, thank you so much for offering that information. Chrissy Phillips says her greatest concern is for her son in him being able to function adequately in society. Anybody else want to add in here? I know we mentioned a lot. You want to say anything else to Chrissy about her concern?
I would suggest to Chrissy that maybe just take it make a list of all the things you'd like for him to accomplish, Chrissy. Put on the list of things that he's really good at, the things he's developing, and the things he's not good at. The things that he's really good at, you want to support them. And then one by one, you want to work on the others. You know, you don't want to overwhelm them trying to attack everything at the same time. Recognize that he might develop these things at a later pace in comparison to other children his age. So let us say that you want him to be able to put on his own clothes, you want him to be able to brush his teeth, you want to be able to take his own bath, you want to be able to feed himself. Rank them in order of priority for you as a parent, and then work on that one at a time. And as you go, you just tick off your list, okay? And be patient throughout the whole process. That would be the recommendation I would give.
Thank you so much, Ms. Rose. Welcome, my hubby Dwayne. Thanks for your support. We have the video trim saying, Mrs. Collymore, I'm a special education specialist. I teach students that require special education needs. I'm from Trinidad. Wow, so we have, thank you so much, the video. We have some linkages being formed here. Averine Daniel says, thank God for programs like this, very informative and current affairs. Thank you, Averine, for your support and following us. And Cook says, Learn Smart is a new one in Coral Gardens, Mobe, opened by speech therapist Nurse Winsome. Thanks for that information. And NM Williams says, my son has characteristics of an autistic child. He has done some of the assessment that is required to see where on the spectrum he falls. I am hoping that by the end of November, he will complete all his assessments so that he can be diagnosed. We do, you know, we do hope so for you as well. And we have, okay, so we have some contacts being shared. Thank you so much for Port of Spain. Pastor Diane says, thank you, Dr. Arusha, for bringing on this program and the topic. This has been very informative, the different views and education on children with autism, very real and interesting. Thanks, Pastor Diane, for your constant support and your feedback and encouragement. And Cook also says, Sam Sharp Teachers College has an early intervention program and assessment center. Pastor Diane says, Georgia's talk has been very empowering. Thank you. And the video says, Ms. Rose is quite correct. Support system is very important. And we have Dr. Charlotte Lawrence Badassi, who has been on our program before. Welcome, Doc, a clinical Christian psychologist and family practitioner. We have Dr. Whitley also joining. Welcome. Hyacinth Blake says, great job, team. Thanks, Hyacinth, for your support. Auntie Janice says she's just listening about brushing teeth. At 6, her grandson would not feed himself. So I told his mom to let him feed himself. He wouldn't starve. The guy slapped me so hard and he started to feed himself from that time. So he was playing us. Wow. So you never know until you give them that opportunity to, you know, show what they can do. And Auntie Claire, welcome from the US. She joined. The video says, excellent team. Thank you so much. We have Shireen Wisdom saying, excellent discussion, very relevant in COVID time. These children can't socialize and spend most of their time at home. The support online for both parent and child is well needed indeed. Tashiana Collins says her daughter has a few red flags. She has speech delay. She has a few words she does not acknowledge her name. She loves to sing. She was recommended to do speech therapy and ABA by her neurologist, but we don't start yet. Family and friend support is so strong for us, and it does play a very important role. Wow. Nikita Mulling says she's learned a lot. Thanks for that feedback. And Tashiana says, I think it was me alone. Wow, I think if it were her alone, she would lose her mind. Thank God we have support, you know, to help us through these situations. Cook says, her son has a tendency to try to sing his educational songs from YouTube. He tries to call the numbers. They don't sound as clear. Does that mean he will speak, or can that go as well? Any input, Dr. Watson Campbell?
All right, so you were just saying that he will not do what?
So her son has a tendency to try to sing his educational songs from YouTube. He tries to call the numbers. They don't sound as clear. Does that mean he will speak, or can that go as well?
Yeah, I think that once the child starts to show the, you know, ability to speak, you can, you know, there's a future in that. What we find is that the children start off by learning to sing. And that is not just for autism, you know, it goes for many other things. But they start off by learning to sing first. And then they start, you know, afterwards they build their skills. The speech and language skills come afterwards. So I would encourage the singing, you know, because he's learning and from whatever he's watching on television. The fact is that he may not even understand what he's singing. So it has to go now from him just repeating words in a song to it now becoming a reality for him to understand what he's singing about. So it's not just the singing, you know, that's just the beginning of it. You have to build on those skills.
Right. And I think some of that may apply to Carleen Bonner Chambers' question, where she says, I might have missed some of the presentation. If a child diagnosed with autism does not talk, how can one help him towards developing speech? Anything you want to add, Ms. McIntosh?
I think Dr. Watson Campbell said it. Most kids learn through song. Most kids. That's why they have nursery rhymes and in preschool, and they have a lot of singing. So music is very good. And it doesn't necessarily have to be song. It could be through drums. It could be through instruments. Kids tend to learn a lot more with rhythm and music. So I would definitely encourage some music. And remember, each child is different. And I think it was Dr. Rose that said, you know, they develop at different paces and we have to be patient, but we could use music and musical intervention to encourage, if not words, sounds, and responding to sounds. I think that will be a very good start. And I would always, if persons have the resources to see a speech language pathologist or a specialist, I will always recommend. I tell parents, you know best in regards to your child. And if you feel as if certain things you're doing is not working, definitely do not hesitate, if the resources are there, to go and see a specialist that can kind of guide you and give you more direct and detailed information on how to help your child meet their goals.
Thank you. And we have Loy McClarty saying, good evening. I happen to join in late. However, I have a question. How can I assist my child with his reading comprehension skills? He will read. However, comprehension is a problem. Any suggestions as to how I can help my child?
Well, I think I could start there as well. as I mentioned at the beginning, when I was talking, I said that speech and language development is really one of the issues that we find with these children. So processing what they are hearing, understanding what they have heard, you know, becomes a big issue. So it boils down to even instructions, you know, them processing the instruction that you give them. But if you're reading even a short story to this child, you have to chunk it. I think this is what I hear coming from, you know, like the teachers, special educators, and so on. You have to chunk it. So you don't read a whole story. You read a bit at a time, and you talk about what you just read. You know, did you understand so and so and so? Who did so and so and so on? What did the dog do? And then you read the next part to it, you know, and you do that comprehension for just that part. So, you know, don't try to read a whole story and then try to, you know, get the child to give you back information about what you just read, no matter how short that story is.
Thank you so much. And we have Nikita Mulling saying, she's empathizing with another mother. My son is almost 4 and isn't adjusting to potty training. Mrs. Noel, how was your potty training journey? If you'd like to share.
It was rough. It was rough. And my advice to any parent going through that is just hang in there and speak to your therapist, whether it's your behavioral therapist or whatever. And there were certain guidelines and we just had to stick to it. We had a table, we had to send him to the bathroom like every, I don't know, couple minutes and so on. And it was very frustrating for me, but more so for my son, but we stuck with it and he finally got it. I was trying to do it on my own and it was a disaster, but I got the help from the therapist and followed it. And just, you know, you have to, your son as well, your child, follow their cues. You don't have to be overbearing with it because it's hard. It's a lot of sensory things going on, you know, that they have no control over. But stick with it, stick with the plan, and then, you know, and hang in there.
Thanks for that practical advice.
Yeah.
And Valelia, sorry if I'm messing up your name, Felicia says she offers ABA therapy in Ocho Rios area and over telehealth. Feel free to PM for more info. We have Chrissy Phillips saying, thank you, Miss Rose. We have Nikita saying she heard of early stimulation center in Kingston. We have Valicia saying she recommends PECS. What's PECS? I feel like I'm learning so much myself.
I think that's a picture vocabulary that is used with the children.
Okay, thanks. And then we have Patricia Williams saying she must thank Miss Rose for all the reinforcement. She has twin girls, age 6, and they both were diagnosed at age 3. It was very devastating, but YouTube became her Bible to learn about the different therapies and stimulation strategies. Now, let me get the rest of this comment. Now one of the girls does not appear to be autistic at all. The other is somewhat still nonverbal, but is now able to say yes and no clearly. She loves to sing. The words aren't clear, but you can identify the song that she's singing. Wow. We have a lot of comments. A lot of persons are seeking help. Cheryl Belcher-Peart says, an excellent program, Dr. Arusha. It's been so rich. Kudos to the panelists. Thank you, Cheryl, for your support. We have Nakisha McDonald Malcolm saying early intervention is key. Her son was nonverbal, but with speech therapy, he started talking at age 5, and it's no turning back for us. Speech therapy isn't the most affordable, but it was an investment that she was happy she was able to do. And we have Loy McClarty saying, thank you for that response, Doc. I'll certainly carry through with your advice. And then Kellyanne Campbell says PECS is Picture Exchange Communication System, like you were saying, Dr. Watson Campbell, often used with children that are non-verbal. Wow. Thank you so much, guys, for all your comments and your questions. I would like to give a very, very special thanks to our panel, our panelists for staying a bit over time and for sharing from your heart, for sharing your experience. And we really want to commend you, Francine. You're the epitome of what moms do in terms of sacrificing for the children, you and your husband. And the panelists want to thank you for the excellent work that you continue to do, and pray that God would continue to strengthen you. So all good things must come to an end, ladies and gentlemen. I look forward to our next program, which would be on November 29. And we're going to tackle a topic called embracing forgiveness. So we look forward to that one as we look into wind down 2020. Okay, it's very important for us all to embrace forgiveness. I want to thank you for spending time with us today. And so, Dr. Watson Campbell, would you like to please close us in prayer?
Okay. Thank you, Dr. Arusha, and it really was my pleasure to be a part of this panel. Let us pray. Father God, we just thank you for just being so good to us. Thank you that you made us in your image. Thank you that you made us so different, and that you have given us different ways to live our lives. Some of us have had to make sacrifices, but always in the end, we realize that what you have given to us is to make us into better persons. So we thank you, Lord, for the parents who have children on the autism spectrum and are working so hard to help their children to achieve the skills that you have given them. Lord, we pray that you'll help them to be patient, help them to be just tolerant, and help us to give this support as much as we can in definite ways as specialists, but also supporting as just friends or families. Lord, just help us to be caring and to realize that we all have a special place in this place that you have placed us in, called Earth. Thank you, Lord, for your many blessings. Thank you for Dr. Arusha and for her willingness to share with others such important topics that will make the lives of people different. And so, Lord, we give you all the praise and give you all the glory, because ultimately it is all about you. So help us, Lord, empower us and give us the guidance that we need, the wisdom to keep going and to do what we are doing to the best of our abilities. This we ask in Jesus' name. Amen.
Amen. So thank you again, ladies and gentlemen, for joining us. Have a wonderful evening. And until next time, keep blossoming. Bye. Thank you, everybody.
Thank you.
God bless you all.
Bye for now.
Bye-bye.